All right, we're live again with Dave from NYC Pain MD. He's back with us again, and we're going to talk some great stuff today. We're going to talk about shoulder pain. Those guys are doing some great work there. There's two medical clinics in New York City, and we're going to put the addresses and the phone numbers and all that kind of stuff up on the screen here. And today, shoulder pain, we're going to talk about shoulder arthritis, rotator cuff injuries and tears, capsular injuries and tears, and we're going to talk about all kinds of treatments. Talk about pain pills, surgeries, and a lot of new treatments out there. You probably don't know about that they're getting some great results with. And we're also going to talk about research. Is there any proof to this stuff? And we're also going to talk about, does insurance pay for any of this new stuff? So Dave is here with us. How would you like to start?
Well, we've been getting a lot of messages on our email. By the way, that special email was we have a special website. Email alex@nyc-painmd.com, alex@nyc-painmd.com. So like we always have to start and say, I'm not one of the treating physicians at the office. I am a liaison, patient scheduling coordinator, patient education coordinator. So a lot of the basic questions may go through me. And of course, only a physician can determine what your problem is, what is proper treatment and so forth. So what we're talking about today is general discussion to pique your interest, make people aware of what's going on out there in the non-surgical, or what we might call the interventional orthopedic world. And, I came across an interesting article from this one doc. I don't want to quote his name, but just to kind of review, he talks about kind of what exactly we've been talking about for a long time. Sometimes things get accepted in the medical world or in the world in general that absolutely make no sense, but it's cause of kind of quote unquote, we've done it like that for so long that you just accept it. I mean, even smoking cigarettes was accepted as normal and even healthy at one time. And obviously looking back, we can see how utterly preposterous that was. And interestingly, in that example, they knew about that it was deleterious for your health for years, but they kept waiting until they had 1,000,000% unequivocal truth and data that it was deleterious to your health. Obviously, we know that was a big mistake. Probably a lot of people got very sick or even passed away not knowing those deleterious effects. And so, while not quite that serious with orthopedic type injuries, I think we've all gotten used to like everybody getting surgery for everything, every little shoulder tear, every knee tear, spine surgery, like left and right. And granted, some of the physicians and surgeons are very conservative, but in general, they're, in our opinion, and it's just an opinion, they're really overutilized. First of all, surgery is invasive. It's aggressive. And if a patient has instability in a joint, you fuse one area with hardware, the other gets unstable. And so one possible repair begets a bigger problem somewhere else. Very true in spine surgery, where two segments are locked together with metal, and then the other segments get unstable above and below. So, where we come in is we're trying to find options and good medically sound answers to help people not only feel better, but try not to get to that point. Another thing about surgery, it is expensive. While surgical fees have tapered a little bit, when you add in the increased cost of hardware and implants and the cost of going to a hospital, I mean, for goodness sakes, just anesthesia costs a fortune. And, you need very skilled people to do it. But if it can be avoided, there's a lot of cost savings involved. And, I think the last thing is, in the medical world and even the orthopedic groups, they're always talking about studies not indicating this or that and wanting research. Yet, not more than 4 out of 5 of the procedures they do have no level 1 studies. They're just done because someone figured it out and it sounded good or worked well. So this is not an orthopedic surgery bashing discussion. You absolutely need orthopedic surgery at some time. We just have to have options, and the options have to be good. And I think those are the things that are really important to bring people to their attention. Obviously, we're onto something because we get hundreds of calls every week of people looking to have non-surgical orthopedic and interventional pain type treatments. And the goal is not only pain relief, Brad, but also getting tissue to heal so it becomes more functional. And so you can use that knee, that hip, that shoulder, that back, and kind of get back on your feet, get more mobile, de-stress your life, and just get happier. So that's kind of what was on my mind. I know we kind of have this loose chat, and I think it'll be a little bit looser than ever today. I think we're getting comments, patients like this because they feel like we're talking to them and not at them. And so that's kind of where we're going. But I have been getting a lot of questions about shoulders, and I must say, I think you'll agree, you can correct me if I'm wrong. We haven't talked too much about shoulders and what's available in the shoulder world for treatment. So maybe we can kind of go in that direction today a little bit. Would that be okay?
Yeah, we've been getting a lot. We've talked about the knees, the backs, and all that stuff, and shoulder injuries are very common, and we're getting a lot of emails about what about the shoulder, and the biggest thing that I hear is I have shoulder pain, whether it's from arthritis, a rotator cuff tear, a capsular tear, and people go down this path and they start taking a lot of pain pills, and the opioid stuff is huge now. And then of course these pain pills don't work, and then they end up going down the surgical route, and you have a whole different approach to that, correct?
Right. Well, again, surgeons are fantastically trained, years of training and dramatic commitment to their fields, and they're highly skilled. But, like anything, there's an old saying, if you use a hammer, everything looks like a nail. So fantastically skilled, but maybe, needing to learn that there's other approaches besides cutting pieces out and chopping pieces out and replacing and all the possible risks that go with it. Just as an offhanded remark, I don't think people realize that 1 out of 400 people that get a knee replacement pass away within 30 days after the procedure. Does that mean somebody did something wrong? No, it just means that there's risk, So here's some interesting studies going back to the shoulder. So there's a lot of shoulder problems out there, and probably between up to 35% of the population has problems with their shoulders. And this tends to worsen with time, and it can be very debilitating. And often basic options, you should first, get some physical therapy, do some exercise, get some chiropractic work, and try these various things to see if they help. And of course, the next level of care often goes into, using steroid injections. So on a rare occasion, in my opinion personally, what I've read and is in the literature that cortisone can damage the tissue. So you can't keep injecting it into a joint, as it can destabilize some of the tissues in the lining of the joint, eat away at the cartilage further. And, it does have secondary general effects. It can make your blood sugar go up. So you can't have it if you're heavily diabetic. It can make your blood pressure go up. Generally speaking, I think over time I'll find more and more problems with heavy use of steroids. And some people are on oral steroids, something called prednisone, et cetera. Some people use the Advils and things, but you cannot take Advil every day of your life. So when you have these chronic problems, you have to look for other answers. And there's a couple basics to shoulders. What could be the problem? You can have arthritis. They call it glenohumeral arthritis, where you wear and tear the cartilage, it dries out. You can have capsulitis, where the capsule actually gets fibrous and damaged. You can have major tears, these shoulder tears. And you can have all sorts of issues with the ligaments. They can destabilize and so forth. So not everything is arthritis in the shoulder. It's not as prevalent in the knee, but these are the issues to deal with. And one of the things, this article I happen to be pulling up now, I'm going to read from it. It says, the accuracy of injection delivery to the glenohumeral joint is very unreliable. And when they examine the accuracy of intra-articular injection, meaning getting into the joint, regardless of the approaches, there is a rather high miss rate. And it's something like between, like 35 and 50%. So as we talked about in the knee, the shoulder seems to be even trickier to get in there accurately. So getting a blind shoulder injection it's almost borderline preposterous. We have all this great technology, and you've got to use imaging. Well, ultrasound is good. We believe fluoroscopy to be the best. But, when we talk about, some of the things about arthritis, people often ask, well, hey, if you guys can get knee arthritis better, what about the other joints? Are they the same? Well, the general answer is yes, but each joint has its own issues. The shoulder is built different than the hip and the ankle and so forth. But the shoulder joint's the third largest of the joints in your body. And usually for some reason, it doesn't get diagnosed till it's much later into the disease. Doesn't seem to be as symptomatic. So normally once it starts hurting, there's a lot of damage in there. But in discussion of using, viscose supplements, which people ask, can you put the lubricants in the shoulder? They found that it can be very effective for not only shoulder arthritis, but also for capsulitis, where there's fibrous tissue in the capsule and so forth. And basically, when you put lubricants into a shoulder, it has a couple basic effects. One, it has an anti-inflammatory effect, meaning it absorbs the inflammatory chemicals. And two, it will reduce pain. It's an analgesic, yet it's safe. It's not an NSAID. And the research, it's not quite sure why it reduces pain, but probably because of the first thing it does. It binds the inflammatory chemicals. And of course, you feel better because you're not as inflamed. Also, when you lubricate the joint, it creates an elastic effect because it's drying out. Like the example of putting a bunch of oil into your automobile when it's down. One of the other interesting things about lubricants, and this is very important for the shoulder because it helps not only with arthritis, but the whole shoulder health, is that injecting or placing precisely hyaluronic acid lubricant into the joints seem to create more natural production. In other words, it kickstarts your joint to start producing more lubricant. And that's very important. This is a biological effect, so you get a longer term effect over time. And so interestingly, in the studies, at least 50% of the patients do much better. Some for 6 months, but some for up to 30 months before they need to relubricate the joint. I think shoulder injection overall will probably even last longer than a hip or a knee because it's not weight bearing. So this is a very interesting thing. And I'm going to read exactly from this particular study, Brad. Is patients with osteoarthritis of the shoulder had a significant decrease in pain and significant improvements in activities of daily living based on the visual analog scale. This was done at the University of California, Los Angeles, UCLA. They say most patients slept more comfortably after treatment, up to 60%. And they basically concluded that hyaluronic acid is a great treatment for patients with shoulder arthritis and adhesive capsulitis. Now, you might ask about tears and things like that. If you have little minimal tears, moderate tears of, say, the rotator cuff, let's take a step. If you were completely snapped all the way through, that needs surgery to sew it back together. But one of the things that seems to be effective in these more modest tears, to the ligaments, to the rotator cuff tendons, is the use of, we've talked about it, platelet treatment. What we use a system called pure platelet, which is 100% high dose of your own platelets taken from your blood, and sometimes combined with stem cells that come from the fat and or even the bone marrow. The combination of those two can actually do wonders for tears, minor tears, and so forth. And this is where you shouldn't go in there and start chopping pieces out and doing surgery too quickly, because there's so many of these orthobiological procedures that can work really nicely. So this is where we're going with the shoulder stuff. And I think more people are starting to call and embrace it and putting two and two together. Gee, we hear about the knees, can you do the shoulders? Did you have a further question, I think, that you asked at the beginning, Brad?
I just want to mention something here about the platelets. That's PRP, correct? Mm-hmm. And
yes.
and then you also mentioned the stem cell. It can be either fat based or from the marrow. Could you quickly say what's the difference between the PRP and in the stem cell? And do you use one or the other treatment, or do you use both?
Right. Well, that's a great question. That's very doctor dependent. Every case is different. As you know, we always talk about it. We have a great program where patients come in at no cost to get evaluated. So the treating physician can make decision what's best. So that's kind of above my pay grade, but just generically, let's talk about what's PRP, platelet-rich plasma. What's done is, depending on how many joints need to be treated, somewhere between 30, 60, 90 cc's of your blood will be taken, and then a special kit with special test tubes or special safe natural reagents is put into a centrifuge, which is a high-speed spinner. And when it spins it down, it separates the platelets from the red blood. And the platelets, so you understand, are what heals you. If you cut your arm or your hand and it heals with a scar, those are platelets coming to action. When there's damage, the body naturally sees the damage and it sends platelets there to heal you. So the way this is done is, so then it's spun down. It's spun down for about 30 to 40 minutes and several times until you get a pure platelet concentration. What platelets do is it stimulates growth factors, it sedates the area, and it basically promotes healing in that tissue. Where the stem cells come in, stem cells are where you have more of a heavy tear and more damage, where you want to create complete new tissue, where you wanted to copy the tissue that's there and try to mend it. So they've done a lot of before and after studies with MRI and founding in modest damage in tears that we can see that area is healing and mending together. Even ACLs in the knee, shoulder ligaments, rotator cuffs, etc. And so if there's really more tearing, then you probably want to bring in the stem cells along with the platelets, and sometimes the doctors will sandwich a stem cell in between the platelets over a few weeks. Sometimes the platelets are just a kickstart that you need to get those tendons and ligaments kind of healing up and naturally getting back to their original state of affairs. But
I know that this stuff's pretty new, or relatively new as far as being out to the market. Is there any proof to this stuff, for the PRP and in the stem cell?
Well, they're doing a lot of studies on it, and they're starting to compare viscosupplementation versus platelets, and they're doing a lot of work on it. So the studies are mainly clinical, and most are showing pretty good results with properly chosen patients. What we really need is a university to take this on and do more level 1 study. However, just like we talked about, even in surgery, there's very few level 1 studies. But we do see that this is working very well on a clinical basis. One of the issues, Brad, is there's no pharmaceutical companies behind this. You're using your own body tissue. That's why they call it autologous tissue transfer. So there's no drug to sell anybody. You can't make hundreds of $millions on drugs. So there's no drug company that's going to support this. So this is going to have to be taken on by hospitals and clinics like ours and funded, privately until we come up with all these answers. What I can say assuredly is that the vast majority of patients are very happy with their outcomes and have been doing quite well. But it is different than the lubricants, and it's done for different purposes. It's done more for damaged tissue where you want to get it to heal, and more for ligaments, tears, adhesions, and things like that, where it really comes in to play.
Basically, you have the viscosupplementation, you have the PRP, and you have the stem cell for the shoulder, correct?
Mm-hmm. Correct.
And does insurance pay for this stuff at all?
So with the lubricants, what's good is if you're in the Medicare world, traditional Medicare will pay for a series of between 3 and 5 treatments to the shoulder. If it works, and when you need a repeat, you can do it again. Hopefully, it lasts several years. I had an interesting call from a knee patient the other day. We hadn't seen her in the clinic for about 3.5 years, one of our first patients in the New York clinic. She actually called about our back program. And she said, yes, she wanted to come in for her back. She was treated for her knee a few years back. And when we talked about it, she said her knee still feels great and she has no need to treat the knee again. She was just calling about her back. Shoulders are similar, and we expect to see even longer periods of time in between shoulders. While they talk about this every 6-month thing, you can safely do it every 6 months if you need it, but we really wanted that to last as long as possible. In-house, our knee pain patients seem to last somewhere between 14 and 19 months on average, some longer. And the shoulder patients, I can't give you enough of a database yet, but we'll work on that. But so Medicare will reimburse. The others are a little reticent and they're more difficult to get covered. The stem cells and the PRP for tears and shoulder issues, that's a new thing. It's called the regenerative medicine world, orthobiologics. So it's a new thing. There's some studies and some things going on with some insurers. I heard out in Colorado, they're doing a study. So hopefully it will kick in soon. But for those that need it, we have all sorts of relatively easy payment plans. Our facility charges significantly less than hospitals and major centers in New York. So if you need the care, we have all sorts of affordable payment arrangements to take care of you. And keep in mind, the goal is that we're trying to avoid surgery, which is much more risky and much more expensive. Even simple co-insurances for a surgery can be thousands of dollars. So we're working on that, and we'll keep pressing that issue and try to open it up to insurance over time.
One of the really interesting things about the clinic there, NYC Pain MD, and we've talked about this before, is it's doing cutting edge procedures, but it's not a huge facility. It has everything there, but you guys are able to keep the cost down, because a lot of people ask me and they say, I would love to get the stem cell, I would love to get this stuff, but it's just way too expensive. And I think that's because they've asked about this at a major hospital, and they've gotten a huge price,
Right.
So could you touch on that for them?
Well, clearly, when you go to a hospital, you may have a certain problem, but you're paying for all the unfortunate indigent people that come in there that have no insurance or can't afford care. So if you come in there and you can afford it, they're going to really push that price up. In other words, you're supplementing the less fortunate people. Also, hospitals have so much equipment that's like not over the top, but they have so much expense to run it. The liability, keeping the place clean, keeping it cold, the amount of people that come into their emergency rooms without insurance. And so basically it's sort of like, Robin Hood, those that can afford it pay a steep price for those that can't. So I think that's part of the hospital issue. I just think in general, they just charge more. There are people charging for stem cell procedures $15,000 in New York. There's no reason for it to be that expensive. Our costs are not even near there. Obviously, every case differs from the next. So what we try to do is take the excess out. Also, if you go into a surgery center, or they do these procedures in a hospital procedure room, just the cost of the facility could be an extra $5,000, $6,000, $8,000. Frankly, Brad, many of these procedures that you don't need to be in a surgical suite. You don't need an anesthesiologist, which bumps up the cost. You can do these in a more simple, nice, private, pretty office-based setting where it's more personalized. And, it's not like walking into a Home Depot to get a treatment or a procedure. One of the things in shoulders, too, that people have to understand is just like knees, there are a lot of pushing at doing shoulder replacements. One of the most profitable areas for a hospital is joint replacements. They love to do joint replacements, and, some people need them, no doubt. But shoulder replacement's a new thing. And certainly before you go to that extent, it's a major joint replacement, trying things like stem cells, platelets, and viscosupplementation certainly are reasonable things. And another area where we're seeing a lot of people coming in for the lubricants are athletes. This is not the older crowd. This is not the older edge of the baby boomers or the great generation before those. These are 35-year-olds working out, playing the tennis, the ladies that are out there running and jogging and tennising, and the ladies as much as the guys, they're at the gym, they're pumping iron, and they're injuring things. They're injuring shoulders, elbows. The way PRP was originally started was treating very bad tennis elbow, and it works very well for that. So all these things are for athletes in the young group to make sure they keep in good shape and they don't end up debilitating themselves over time. So obviously there's more to treating than just injecting a lubricant or stem cells or platelets. And there's rehab that has to be done and certain precautions. But obviously our position is to do these interventional orthopedic type treatments.
if somebody's out there listening to this right now and they have shoulder pain, whether it's from arthritis, rotator cuff, capsular injuries, all these things, what should be their next move?
So, if your shoulder is just a little achy from a heavy workout, a little bit of an ice pack and some stretching, don't worry about it. If it's bothering you and, you're not adverse to taking the NSAIDs, an Advil or two, and, it goes away, don't worry about it. If you do a little stretching and it helps, don't worry about it. If you're still hurting and you've tried some physical therapy, you've tried some stretching, even went to the extent of letting somebody put a steroid in there, and you're still not feeling better, well, then the next algorithm might be to check in with a clinic like ours, where you come in, you get evaluated, an x-ray may be ordered. Some patients, if they seem like they want to rule out a tear or something, we may order an MRI. You'll be examined. The doc would ask you a lot of questions, and then you can make a decision on where you go from there. But the next step after not responding to therapy or some over-the-counter analgesics is not going to surgery in most cases. That's where we come in. The next step in the algorithm is considering these orthobiological procedures, lubricants, stem cells, platelets, a combination thereof may need to be done. Sometimes you need all of them. Sometimes you just need a little bit of one of them. Every case is different. So if you're there, if you've tried the other stuff, if you're non-responsive to the therapy and the Advils and you've tried all those things, then you need to check in with somebody like us. And if you want to come to see us, you can email me at our web address, which is alex@nyc-painmd, alex@nyc-painmd. You can call the number that you'll put on the screen. And we have a great program. We offer no-cost screenings. We don't think you should be inhibited from coming in to find out if we can help and having it cost you hundreds of dollars. So you come in, let one of the docs check you. They'll be very thorough. They'll answer all your questions. And hey, you may not be a candidate for what we do, but if you are, the docs will take you through what they think. There's no obligation or stress. If they think that we can help, they'll send you in the right direction. And then you go from there. So it's a good way to take the step into finding out what's out there for you personally. Obviously, we discussed a lot of different things for shoulders and wet your whistle a little bit, but if you're hurting and you feel the need, you take advantage of our no-cost screening program. Call the number that is on the screen and just let them know you're hurting in your shoulder. You heard about our programs and you want to see if you might be a candidate. It's as simple as that, a simple phone call.
Get over 100 calls a day sometimes too, and it's crazy because I try to get in touch with you sometimes and I can't. So it's important if they want to do this, do it right now. And if they call and they can't get through, call back, right?
Yeah, a lot of times. I mean, we always have a lot of staff on, 2-3 people picking up phones all day because we have general patients that are calling and newer clientele that wants to get information about treatment. So if we're barraged with calls, it'll always be a voicemail. Simply leave your name and a phone number, the best time to call us back, and someone will get back to you within no more than 24 hours maximum, and they'll answer all your questions. And, if it's appropriate, they'll set you up for the screening evaluation and take it from there. We have 2 facilities where we evaluate shoulders in Manhattan, one in Midtown, one downtown. Pretty convenient. We're there from 8:30 in the morning until 7 at night. So you just have to call and find out what works for you.
And the cool thing about the screening is they're going to get to talk to a doctor and they're going to find out what's wrong with them, get some answers and get some recommendations. And if it's you guys can lay that out for them, or you can help them find another doctor that's best suited for them.
Right. Clearly, there are some cases that are not nearly severe enough for us to even start with. We'll write them a script for physical therapy, some rest, some ice, a few at-home procedures. There are clearly patients that absolutely have the need for possible surgical intervention, and we'll, have them call some sort of surgeon to take a look. And then there are those that may be appropriate for us. So that's what you're going to find out. So I think the key to the evaluation procedure is you're going to come in, your worst case scenario is you're going to get some direction and you're going to have a plan of action. And whether it's something we think we can help you with, or the plan is to refer you to a source that will, you're going to have a plan. You're going to feel a lot better. But There's a lot of patients out there. They wake up, they can't sleep on the shoulder. They reach back to put on a shirt, a blouse, a jacket. They reach up over their head, and they're hurting all the time. And if you let it go too long, of course, more and more damage occurs. And then we've got a bigger problem to deal with. It's like any disorder. If you leave it to fester, it gets worse and worse and worse. So that's the best action to take. Call, see what we can do for you, get some direction, get some planning, and then take it from there.
Yeah, it's great. That's about it today. We're starting to run short on time, and I know you're probably going to have to get back to work here. So
Right.
It's great. It's great stuff. You guys also treat, knees and backs and just all. You guys are doing some great work there. I'm going to put the website up on the screen here, and I'm going to put the number to call. You can check out the website, and there's information on, like I said, knees and backs and everything. You can give them a call, and you can get a free screening for any one of these things. But we talked about the shoulder today. And so if you have some shoulder pain, give them a call, and they'll hook you guys up. Dave, once again,
Anytime.
Thanks for being on. Every time you're on, we get a great response, and helping a lot of people out.
Okie doke. Okay, so we'll talk next time.
Bye-bye.
Good enough.